Hanover Regional Medical Center, and you're going to show us our AED.
I am.
Oh, yeah.
Okay, so you want to make sure that 911 has been called and then we're on our way. And
Okay.
in the case of cardiac arrest, chest compressions are continuing right now.
Okay, and this is what it looks like,
Yeah.
all zipped up
This
and
is the
pretty.
machine, so the machine will be brought to the patient's side.
Okay, cool.
You'll unzip this, one continuous zipper, and you'll open it up like this.
Okay.
And then you'll turn it on, this green button right here, to power it up.
Okay, I wanted to touch the
Begin
button, but that's okay.
by removing
Sorry.
all clothing from the patient's chest.
Okay.
Cut clothing if needed.
So whether or not you have a flannel that you can just rip, or if you have to cut the clothing, this kit has a pair of trauma shears in it, which is a small mini version of what
When
I use in
patient's
the
chest
ambulance.
is bare,
It'll cut anything. So you just
remove
cut straight
protective
through and
cover
then expose.
and take out white adhesive pads.
So as you can hear, the machine is telling you to pull this, you pull this down just like a fire alarm,
Look carefully at the pictures on the white adhesive pads.
and then remove the
Peel
white
one
adhesive
pad
pads.
from the yellow plastic liner.
And as the machine is directing you to, you pick one and you remove it.
Right.
So this one is going to be down in the patient's lower
Look
left
carefully
area
at
in
the
here.
pictures on the white adhesive pads. Place pad exactly as shown
Flat
in the
on the
picture.
skin.
Press firmly to patient's
And push
bare
firmly,
skin.
just like the machine is saying.
Okay.
The second pad,
When the first pad
patient's
is in
upper
place,
right area.
Right.
look carefully at the picture on the second pad.
Unpeel it like
the
that.
second pad from the yellow
Push
plastic
it straight
liner.
down and make good
No
contact.
one
And
should
not to be
touch the
stupid, but
patient.
that's important to look at these
Analyze it.
pictures, because I would have thought immediately to go for the heart.
Absolutely.
And so that's really important to
No
see those
one
pictures.
should touch
Yeah,
the
okay.
patient.
And as the machine is
Analyze
directing you,
it.
nobody should be touching the patient. This doesn't mean get up and
Shock
run away.
advised.
The machine still needs
Stay
you.
clear of patient.
Well, push the button.
Press
And
the
I
flashing
thank you. I get
orange
to touch- I
button
get to touch the
now.
button.
Shock delivered.
Okay.
Be sure emergency medical services have been called. It is safe to touch the patient.
Okay.
Begin CPR.
So
For
the
help
machine
with
will direct you.
CPR, press the flashing blue button.
To continue compressions, and then 2 minutes from now, it's going to say stop compressions, and it's going to do it all over again. These pads will stay in place while you're continuing compressions.
Okay.
After 2 minutes, it's going to look again and then see if there's something shockable. It'll shock, and then
1
it'll
minute,
redirect you to get
45
back on
seconds
CPR again.
until
It'll start that
analysis
2 minute
will
cycle all
resume.
over again.
Right. And like you were saying, it won't do anything if there is not a need, because it's doing the assessment itself.
Yep, correct.
And that was one of the myths that is out there, is that this is like a jump start or a shock. And I
Yes.
think that's important for people to know.
Yes, it's a defibrillator, not a
Right.
jump starter.
Right. And so it will tell us whether there needs to be something there, and it works for people with pacemakers as well.
Yes, it's completely